I'm a local resident in South Jersey, and I have the pleasure of taking care of our community in my own backyard. It's a good community. It's a good place to raise a family. It's a good place to live. Wonderful people. And it's funny because sometimes even when I'm out and about at the mall or the grocery store or something like that, I'll run into patients that I've seen or taken care of before, and they'll come up and chat with me and have a conversation with me. I grew up wanting to be a weatherman, and my dad unfortunately had a heart attack when I was in high school, and that got me sort of diverted off into the medicine world, and then I never looked back after that. I've been a physician for close to 25 years now. I spent 7 years in family medicine and close to 17 in emergency medicine. And urgent care was a good option because it was sort of a hybrid model between ER and family medicine. And it gives me an opportunity to mesh those two worlds together. We're embedded in the community. I mean, that's an easy answer. We're here, we're available. We have a large network of physicians that we interact with, specialty care services that we offer, primary care, timely appointments. I think one of the things that people may or may not understand about urgent care is that we're not an emergency department. So if you present to the urgent care with chest pain, labored breathing, something of that nature, there's a high likelihood we're going to be referring you out to the emergency department. However, it does at least hold some advantage in urgent care where we can do an initial assessment on the patient and determine the degree of urgency. Minor to mild lacerations, mild orthopedic injuries, cough and cold syndromes, things of that nature we can handle without any problem in urgent care. We in urgent care have that availability to see the patient when maybe somebody else won't. They can't get an appointment with their primary care doctor. They can't get an appointment with their specialist. At least they can come in, have a doctor or provider evaluate them and give some sort of evaluation on their condition, what the recommendations would be for care and follow-up and this sort of thing. So we like to pride ourselves on being available when other providers may not be. I think I get a lot of satisfaction being able to just provide high quality care to the patients. That makes me want to go to work in the morning. I'm going to get up and I'm going to make a real tangible difference in someone's life.